I'd like to welcome everyone to our session this morning about the Dane County Sheriff's Mental Health Team. Leslie Fox is a deputy with the Sheriff's Office and has been a longtime partner here with the Triad of Dane County and the Wisconsin State Triad. Leslie moved over, didn't you, Leslie, was it a year ago or 2 years ago that you moved over to the Mental Health Team and have been stationed there? Before that, you were a community deputy, I believe. Leslie, go ahead and tell us a little bit about yourself and get started.
Well, good morning, everybody. Like Mike said, I'm Leslie Fox. I've been with the Dane County Sheriff's Office since 1998. So yes, I've been around a long time. Started off in the jail like everybody does, and then maybe 3 years in, got out onto our patrol division as a community deputy. And that is since morphed into mental health deputy, which is what this presentation will be about. And I'll kind of explain that in a little more detail. And I'm okay if you guys have questions as we go along, that's just fine. You can interrupt me or put something in the chat. Me and Mike will try to monitor that. But there should be plenty of time for questions either way. So, okay, we'll go ahead and get started with the slides. Mike's going to help me out with those.
Okay, can you see that, Leslie?
Yes, and you can switch it to the next slide, and I'll explain a little bit. Okay, so like I said, I'm one of the mental health deputies. So here's how this all came about. The Dane County Sheriff's Office had 8 community deputies previously. And then we were starting to trend towards seeing a lot, this is pre-COVID, a lot of mental health type of calls or responses or people calling 911 in crisis. So that was already pre-COVID. We could kind of see the uptick. So I was already starting to do this work many years before becoming a mental health deputy. So I was doing in the role of community deputy, which is a whole nother presentation to explain what that position is, but we're kind of the jack of all trades. So I was doing a lot of mental health work. But luckily, at the very end of 2022, the sheriff and the county exec, I think we're also seeing this need and saw that there was a high need with our responses to mental health, that we could use some deputies that were just dedicating themselves to these type of calls and follow-ups. So the very end of 2022, we really got going more at the top of 2023. 8 of us that were community deputies, we split in half, and 4 of us became mental health deputies and the other 4 remained community deputies. So, and we're going through a couple changes right now. We have 1 deputy retiring. So at the top of the year, we will have myself and Deputy Scott Harum that will be mental health deputies. And so we're the second and third picture on your screen. The first picture is Lieutenant John Triggs, who is our direct supervisor for the unit. And we have since just finished a process to fill 2 vacant positions. So sometime next year, we'll be back up to full force again, and we have 4 mental health deputies. We will have 2 for the east side of the county, which will be me and Scott, and then 2 on the west side of the county. 2 of us will be more day shift hours, and 2 of us will be more second shift hours. Additionally, the other part of our team, which is very vital, is we have embedded mental health workers that work alongside us. They co-respond with us, and we'll go into more details of kind of what they do. But they can ride with us, respond to calls with us. And they are all employed through Journey Mental Health here from Dane County. It's just they spend most of their time with us at the sheriff's office. So right now they each spend 3 10-hour shifts with us in a week. and then they spend 1 day on the unit at Journey Mental Health. So we have at least one worker Monday through Friday with us at the times right now are varying from about 8 or 9 in the morning till as late as 7 o'clock at night right now. And we will adjust those accordingly, sort of as needed, especially once our 2 new deputies start. So that's kind of what the unit looks like right now. Again, we have some changes coming up here in 2025, but we should get back to full force at some point. So, okay, Mike, you can switch to the next slide. Okay, so just a little bit of a program overview. So like myself, I'm a full-time mental health deputy, and then we work collaboratively with our embedded mental health workers. And I should have started with, we've had embedded mental health workers with us since 2019, although the position has not always been fully staffed. So that's sort of been intermittent. So it's nice we have 2 almost full-time people with us now. So we're working together as a team. We're also working with other folks out in the community, probably some of you that are on the call right now, because I recognize a lot of names. So other mental health providers, advocates, and the community. So we are responding day to day to active calls for service, and that can be a wide range of types of calls. We are doing a lot of follow-up, connecting people to resources, checking in on people, seeing how they're doing, follow-ups reference emergency detentions, or various calls for service that we've had. And we'll get into more details. I'm doing a lot of individualized response plans, so police plans, and I've got a whole slide on that coming up. So we're doing a lot of work with that. Again, like I said, connecting people to resources, information sharing as appropriate or as we're able to do. Education and training, so that's presentations like today, training deputies or the community as needed. And then also in some of the groups that I'm involved with, we also trying to address any systems, issues, and concerns that come up. So that's sort of just a broader overview. And we'll go into more detail on some of those in some upcoming slides. Okay, Mike, I think we can go to the next one.
I'm having a control issue myself. Leslie, I'm wondering, we know Madison has a mental health team. Do any other communities in the county have mental health officers, or do you do any training with those that may not have specific units but are concerned with the issue?
Yeah, so we collaborate quite a bit with the city of Madison and their mental health team. And they put on a couple of really great trainings a year that we usually try to attend. There are other agencies that have, like Fitchburg has a social worker that helps them out at the police department, and Sun Prairie does for sure. And if you're in either of those communities or another community that you have a question on, I would get better and more detailed information directly from that police department. But yes, definitely that is more of the trend around here for the collaboration for sure. And what is the purpose of that? So that was a good question to segue into this next slide. So we are trying to create a better response to mental health related calls. There are a lot of them. They come in daily, and we want to, and 911 is often the first call versus, you know, Dane County Crisis or 988. They are certainly fielding a lot of calls, but a lot are still coming directly to 911. I always say, you know, what's the number we were taught from a very young age to call if we need help or have an emergency, and it's 911. And I definitely still see that in a lot of cases. People didn't know who else to reach out to, but they knew to call 911. And so part of my job can help, not only help them in the moment, but get them in the right direction for maybe some longer term issues or services that they might require. So trying to create that better response plan, and part of that is going to be these police plans, safety plans that we're going to talk about in a little bit. So we're trying to create a better short-term outcome for our community members. We're trying to do proactive follow-up work that might reduce our calls for service, and so that person doesn't need to have law enforcement contact every time. We can help get them connected to resources, or maybe it works out better if they call Journey Mental Health the next time, if there's not somebody actively being harmed, things like that. So we can provide education around that. Because not everybody wants law enforcement at their door every day. So we're trying to get people down the right track in case they have further issues that come up. I think it's also improving our relationships with the community and the mental health community, and with those needing services. We often do get that feedback. People are very grateful that we were able to steer them in the right direction when they call 911. So diversion from incarceration, that's a big one. You often see in the news how mental health is criminalized. And we definitely don't want to see that when that's not appropriate. And as someone that's a deputy sheriff and started off in the jail, definitely that's a passion as well. If people are in a mental health crisis and we can get them a better, least restrictive option, that's what we're going to move towards. So, and then there's a lot of problem solving that happens on a day-to-day basis. I think some of our calls have become a little more complicated and time consuming. There's a lot more happening maybe than just a mental health diagnosis. And so some of the, every call is different. So we put our heads together with not only our team, but those outside resources that we utilize, whether that's adult protective services or our local senior center. Just there's Journey Mental Health. There's just a lot of other people we collaborate with and try to problem solve. So, okay. Next slide, Mike. So what do I actually do on a day-to-day? Actually, the first thing I try to come in and do if there's not an active call right away, after I make my tea, which everybody laughs at me about because I'm not a coffee drinker, I am reviewing reports. From the last time I was on duty, I go through every single call for service that we've had here at the sheriff's office, and I identify ones that do for sure have a mental health component, or maybe they do, we're not sure, we need to look into it a little more. And I send those out in an email to the team every morning based on what precinct they're at. So we have sort of a starting point for the day. We can triage, see who needs immediate follow-up, maybe who's a repeat call for service, who needs to be checked on today. Should this be a phone visit, a home visit, or something else? So that's how all my days start, unless of course I'm running out the door to an active call already. So when the active calls do come in, we are responding to those as a deputy, or our mental health workers are responding, or both of us. It kind of depends on the call and what the patrol has the need for on each particular call. So we're coordinating those follow-up efforts. Again, I make calls to sometimes the jail, sometimes social workers. Some of the folks that we are having calls for service with already really have a behavioral team. And so then my job is to get in contact with them so we can try to kind of stay on point with what our response and follow-up is with them, so it's consistent with what their team already has like an expectation for. We are conducting outreach as necessary. Again, might be a home visit, might be a phone call, just sort of depends on the situation. Mentioning again those safety plans and alerts we can put on through dispatch. And we will talk about, I do have a special slide just on those, but we are able to put alerts on addresses if appropriate through our computer aided dispatch. So if a deputy is responding for a call for service and we know someone there has like special needs or a specific mental health concern and maybe has a police plan, we can kind of flag that at dispatch, and then deputies can pull that up on our information system that we have access to in our squad cars. So that's an important piece. I'm also the communication vessel to patrol and anybody that might be responding to active calls for service, to be relaying that information of some of these specific mental health needs that this person might have that they're responding to. And then I'm doing all the front end support for emergency detentions or return orders. That's a primary responsibility of our team. So if I come into my shift in the morning and somebody is currently at the hospital for a med clearance for an emergency detention, the expectation is we go and relieve the deputies that are currently at the hospital. We will take over from there to finish the med clear and the emergency detention form and the transport and all things related to emergency detentions. Those are very long calls that usually go through multiple shifts. So we provide the support for patrol so they can get back in service to take other calls. So, okay, yeah, next slide, Mike. Okay. So education and training and presentations, I would say presentations and events for this year, probably at about 25 that we've done for the year to various organizations. I see a couple questions in the chat, so I'll get to those in just a minute. Relevant stakeholder meetings, I'm involved in a lot of different meetings around the county. So the Crisis Stabilization Coalition, there's quarterly hospital meetings, forensic systems meetings, and a lot of those are collaborative meetings. So people from different agencies are coming together and we're kind of working through any systems issues on a specific case or otherwise, and how can we do this better the next time. A lot of the training is for deputies. We have been able to get into our mini academy and do crisis management, emergency detentions, and that type of training. Our mini academy is when someone is transitioning from the jail out onto patrol. So from our jail into our field services, which is patrol, they get an extra 3 weeks of kind of quick training just specific to patrol calls. And we were able to get in and we have a 5-hour block to talk about mental health, which is amazing. It's the largest block in Mini Academy. So we're very grateful for that. And then we also come back in on their scenario day and we run them through mental health specific scenarios, because they are going to get a call probably their first day out on patrol that's mental health related. So we want to make sure they're ready for that. I'll go into the chat here. So a question is, what is an emergency detention? That's when we take someone involuntary into custody because they are a danger to themselves or others. That's sort of a very quick, simple definition, but someone has engaged in some dangerous behavior and they don't want to voluntarily get help. So we are involuntarily taking them into custody to the hospital for med clearance and then to whatever the next destination is, another hospital. So yeah, I'll make sure for some folks that are looking for some additional information after the presentation, my contact information will be on the last slide. You can email me anytime and I will share what I have for sure. Yeah, so another question just came in. So no, that first slide where I talked about there'll be 4 deputies on the mental health team. So the question is, am I the only person that does this? No, we're have 4 deputies and 2 crisis workers right now. However, we have a little bit of a transition. We just selected the 2 of the 4 deputies. So it's me and Deputy Scott Harum. And then our 2 new mental health deputies will start sometime in 2025. I don't have the date. We did have 3 of us, but we have 1 person retiring, so it is a little confusing. So we do not, right now, our coverage is only Monday through Friday. We don't have weekend coverage right now for mental health deputies. There's just not enough of us. So, I mean, patrol really is front end and takes all the mental health calls if we are not on. They will be the primary, but at least with the 2 newer deputies that we have starting, we're going to get coverage into second shift. So our coverage will get a little more during the daytime, evening hours. And once a week, I come in a little bit early on the third shift to try to cover some of that, which has been effective because third shift does run into mental health calls. So.
One little question, I was just thinking, Leslie, Madison recently expanded its coverage, you know, with the CARES team, you know, and it just, do agencies coordinate with each other? You know, if, you know, you're not, you know, you don't have anyone on the weekends, would you ever call for consultation with you know, a mental health officer in Madison, or you go straight to Journey Mental Health and let them take care of it?
Mental health. Yep, and just to be clear, the rural areas, Dane County, my jurisdiction, we do not have the CARES team. That is only for the coverage that Madison City Fire covers. So it's mostly the city of Madison. There are a few addresses out in the county that is serviced by Madison Fire that we could get CARES to, and CARES is expanding to, my understanding is to the city of Sun Prairie, but not to the town of Sun Prairie. So I cover townships. So we don't have any CARES available to us where I work. And neither do most of the other suburban agencies. So that's more of a city of Madison program. So I am your CARES team basically as well.
I didn't realize how they decided, you know, that it was basically, if it's covered by the fire department, it's going to be a CARES team.
Yeah, so we have a little bit of town of Burke and town of Blooming Grove, I believe, that Madison Fire covers. So there is a very small chance that if it's a mental health call in that area that maybe CARES, but CARES is very busy. So, you know, they're getting to all the calls that they can, but we don't have that mostly, so.
Thank you much.
Yeah, I hope that answers most of the stuff in the chat for now. I apologize. We'll do a double check at the end if I miss something, so. Okay, why don't you go to the next slide, Mike? So I've already touched on this, but our embedded mental health workers work for Journey Mental Health, but most of their assignment is with us at the sheriff's office. So again, they are working 10-hour shifts right now. And we usually have one of them on Monday through Friday. Wednesday is their crossover day where we have 2 workers on. And their coverage is about 8 a.m. to 7 p.m. between their 10-hour shifts because they work staggered hours. So they are able to co-respond with us to an active call for service, which is amazing because our goal is always to keep people in their least restrictive environment. So if we can safety plan them and they can remain at home and get directed towards resources, our workers can do that right on scene. If we need an assessment for an emergency detention, they can do it right on scene in the field. So if an emergency detention is approved, they do it right on site for us. And then we only have to go to the hospital for the med clearance. We don't have to go to the hospital to talk to psych or the social worker or any of that there because it's already approved. So we're just going for the med clearance. which can save us some time. So having them do those assessments and safety plans on scene and hopefully allowing that person to remain in their environment is amazing. They're also available to do consultations via phone if in person is not something that can happen in the moment. They help us identify individuals that are in need of outreach. They can do the outreach without law enforcement if that's appropriate, or with us collaboratively. It just sort of depends on the case and how comfortable people are with law enforcement or with a crisis worker. You'd be surprised. I've had people that are a little leery of crisis workers or social workers, but they're okay talking to the mental health deputy. So we'll try to work that whatever the person's more comfortable with. They are our embedded crisis workers are a great resource to help connect people to resources around the county for their mental health needs. And we can kind of do some light case management if that person's not already connected with somebody. So we can do some check-ins. Hey, were you able to follow up with so-and-so and get an appointment? And how is that going? Is that helping you? Doing those sort of follow-ups. So it's not just always a one and done and then that person doesn't get any other additional follow-up. We try to stick with that person until we know they're connected with the appropriate agency or therapist or outpatient program or whatever is necessary. And again, our goal too is always to reduce repeat calls for service by the same community member. Again, that could be traumatic to have repeat police calls to your address or for you on a regular basis. And for some of our folks, sometimes that's almost daily contact or weekly contact. So whatever we can do to sort of reduce that, I think in general is just beneficial for everybody. Okay, you want to move to the next slide and we'll move into safety plans. So this is a generic form that we use for our safety plans. This is very similar to what the city of Madison uses as well. As I based ours off of theirs when our program started. They've been very, very helpful with information sharing when we were getting our program started. So this form can be tweaked and verbiage changed depending on what the situation is. I've even changed it to just say information bulletin or whatever I need to at the top. So we get basic information, the photo, a little bit of history. You can see there I have commitment status, legal status. Not everybody even has those, so we can just cross those off if we don't need them. I just delete that part of it. Diagnosis, if we know that. Primary contacts, like who should we be contacting if we have an emergency with you or a crisis? Who are your people that you want us to know about and that we should be contacting? The big thing these safety plans are good for is on the right-hand side. That's what we are. Oh, somebody says they're not seeing the form. Is everybody seeing the form? I have it on my screen. I get some thumbs up. Okay. I'm not sure what might be a tech issue for a couple of you. So on the right-hand side, you see I have hooks and triggers and other information. This is really what the deputies are looking at if they have time to look at this prior to the call. How do we develop that positive rapport? How do we not escalate people? What are some things we should not talk about because that can be very triggering for them? We will put that on this form. It's really important. And then we just sort of have the catch-all for the information and negotiating tactics. I have an example there. Almost all my safety plans say, short, simple sentences, maybe give them time to process before they answer. There'll be some sort of verbiage in there about that. And then we try to make it very specific to that person and how they communicate when they're dysregulated, for instance. So we will use similar alerts, whether it's dementia, special needs, mental health, or a combination of any and all of those. Sometimes it's hard to identify somebody on a call if we're not familiar with them, of what might actually be going on with them, or what are their barriers in communication. So the more information we know ahead of time with these plans, the better it is and the better our response can be. And I'll have that in another slide too in a little more detail. So we work a lot with these plans. We like the person who this plan is about to be involved, if at all possible. We will meet with them when, you know, it's a good day or they're not dysregulated. Hey, if we have to respond again, what can we do to help you in that crisis moment? What can we say or do to help you get through that in the moment? And we can articulate that on this plan. So, I know some people have really appreciated to be able to have a say in their plan, right? Because it's about them. So, and then if we do have a police response and we use this plan, I try to then do follow-up with the family, the caregiver, the person themselves, like, hey, what worked? What worked? What didn't work? Hey, the plan hasn't been updated for 6 months. Is there something we should change or tweak on the form that could help us out if there's a next call? So some of that follow-up, this is part of it as well. Okay, do you want to, I think we go to the next slide, Mike. So just a little more on our safety plans and why it's important. If you're not sure if you have a police department in your area that has a mental health officer or deputy, or you think a police plan might be needed for somebody that you're working with or is in your family or caregiving for, call your local PD and just see what they have to offer. It might look different in different jurisdictions. But I think it's the pre-planning, the collaboration, I think is vital. We want people to be prepared if they might require a police response. So we really never know when or if that might happen, but the pre-planning is very important. We want that person, like I said, to have a say in their plan. What are their hooks and triggers? What's the best way for us to approach them? I also think this is very vital for the person that may need to call 911 about their loved one or the person they're caregiving for. We can help do mental scripting or rehearsing, help them, because that's very traumatic if we have to call 911. I'm sure many of us on here have had to call 911 before. I've had to call 911 off duty several times myself as well. We're feeling a little stressed, right, when the dispatcher answers. So if we can help people rehearse that ahead of time, here's some questions that dispatch might ask. Here's some information they might be looking for. Here's what to say to dispatch. Anything we can do ahead of time when you're not feeling that stress, it's like training, right? If we work on it when we're not so stressed out, when that stressful event happens, we're going to be more prepared. So I think that that's really important. It's also good because it gives me a better understanding. Who is that person? What is their life story? How can I help them out in the moment? I just think it improves the way we respond to people in a crisis, helps us make informed decisions. Again, I'm trying to keep people out of our jail, out of the criminal justice system when it's not necessary. And it can help us come to a more appropriate disposition that could maybe be in sync with the person's family or care team and what those wishes are. The more information we have ahead of time, I just think that, and the collaboration, we have seen some success in some of our calls for service. I also want to talk about something that I've been seeing a lot more, and that's caregiver stress. It's stressful being a caretaker, a family member with somebody that's struggling with any number of needs, right? I'm seeing on calls a lot more that we have a person in crisis and also the caregiver in crisis. So it's kind of a dual situation in some calls that I've encountered. And so it's also important when we're doing all this follow-up that I'm checking up on the caregiver as well. Not just the person we got called for, but who else is living in that home? Who's the caregiver? Sometimes it's a private caregiver, sometimes it's at a facility. And they were really stressed out about the incident or experiencing some trauma from whatever happened. And so I want to always make sure that we're addressing that as well. That's the other reason for why some of this mental scripting and rehearsing is important. We want to prepare that person for calling 911. And not only maybe what to say to dispatch, but what might you need to do to stay safe while you're waiting for police to respond? That can also be part of it as well. Are there additional safety measures that you need to put in place as we're responding to keep everybody involved in the crisis situation safe? And then we can also talk through them keeping important information in a shared space in the house or the place, so we might have access to it as well. Again, these police plans, we have access to in our squad cars. Now, I will say, we don't have all of them memorized, right? We have quite a few people with plans. We advise deputies to look at them ahead of time as we send them out. They're available to look at any moment. But if there is something actively happening where somebody is getting hurt in the moment, we are running lights and sirens. We're getting there as quickly and safely as we can. I'm not going to stop to pull up the plan. Okay. Our first response will be to get there safely and get the scene safe. Make sure everybody's safe. Nobody's actively being hurt. Then we can take a step back, take a breath, look at the plan, kind of almost switch to a different mode, right? Scene safety, person safety first, and then we're going to switch into, okay, what is happening right now and what do we need to work on? Okay, almost switching hats a little bit to not even as much of a law enforcement role. Sometimes it's more of a social worker role in the moment, like figuring out disposition. Who do we need to call? What was the prevailing factor? Is this going to be hospital, safety plan, connection to resources? Is it someone we just need to help de-escalate and then we can leave the scene? A lot of different dispositions. So oftentimes if deputies are going to one of these calls, it's going to come up in our call notes that they have a safety plan. One of our partners can look up the plan as the rest of us are going, or again, once the scene is safe, then we have time and we can go back and look at these plans. So they are very much available to us while we're on a call. Okay, we can move to the next slide.
Okay, and I just wanted to comment real quickly, Leslie, in October, we had Jane DeBro, who's the caregiver specialist for Dane County. We have an hour with Jane on our YouTube channel. So anyone interested in that previous presentation and the contact information, head to our YouTube channel, Triads of Dane County, and should be right up there at the top.
Great. Yeah, some other things we can do as well. I talked about how we can access these plans from our squad car. We can put the safety alerts on the address. I talked about already how part of my follow-up considerations when I'm doing follow-up, if there's been an active call, does this plan need to be updated? What did we do right? What did we do wrong? What can we try to change in the future if there's another call to make this go more smoothly? One thing I always talk about with people as well, weapons in the home, medications in the home, things like that. We can offer medication safety lock boxes, gun locks, things like that to help keep people safe. If almost everybody I talk to now, I want them to have their meds locked up. Mental health issue or not, parents, grandparents with kids coming over, meds should be locked up. So as much as I can facilitate getting med boxes out to our community, that's another part of that. Weapons, we can typically get a hold of gun locks, so we can help out in that situation. In a lot of cases now, I have to talk to people about locking knives up or other things in their home that could be a more immediate and dangerous weapon. So I have people that we've worked with that just have larger cupboards or even like smaller closets that they just have to keep everything locked up in there as well. So whatever we need to do to help keep people safe. And any of those locking devices that I can help out with is another aspect of what we're here to do as well. Okay, I have a couple more slides and then we should have enough time for some questions. You can go to the next one, Mike. And so this is Triad. So I just wanted to have at least one slide of how we're helping older adults. So we're trying to work together with all of you. I know there's people on this call that know me and we have worked together on cases. I know I mentioned Adult Protective Services and their investigators there. Amy Scar, who I think is on this training as well. So our senior focal points are very vital to me, especially out in the rural areas. I can't live without our case managers. We routinely go on joint home visits, collaborate whenever we can to try to help our older adults. Some of our main referrals are to the ADRC, our local senior centers, the Alzheimer's Association. These are just some of them. So I know there's more. The dementia program specialists, the behavioral health resource center. So we're trying to get people connected to all the things, which can sometimes be overwhelming, especially for older adults. So I like to do a lot of those cases in conjunction, like I said, with the case managers and in person. That's usually a goal of mine, especially if there's any dementia involved. Like to do all of that follow-up in person if I'm able to. A lot of home visits, check-ins as we can. I think half the battle sometimes is just building that trust and rapport, and getting that safety planning done. So that's a big part of what I always did as community deputy, and I've just carried it on to mental health deputy as well. One thing I've been trying to do a lot, we have a lot of people living in our community that may have a dementia diagnosis, or are older adults living by themselves, or an older couple, and maybe there's not family super nearby. So I really work hard to get all that emergency contact information, and I can get it into our system as necessary. So we've had some cases where there's been a medical event and we've needed to get a hold of other family. And so having that readily available, like in one of my reports, has been really helpful for contact information, or just having a information sheet on that. So, and then again, which is kind of my soapbox, is just being mindful of that caregiver stress. So I try to work that into most of our follow-up considerations now, just because I've been seeing it so much. And in some of the cases, it's been then I'm not just going to one person in a crisis or who's suicidal. Now the caregiver actually is as well. And so those are some of the cases that can take a little longer and be a little more complicated because of everything that's going on. So the team I'm on now really expands beyond the Dane County Sheriff's Office, right? It's all of you guys here and the agencies that you work for, and all the wonderful community stakeholders that we work with as well, that are doing a great job. So I appreciate all of you guys and everybody that helps us out with these calls. Does my department use File of Life? I don't in particular, I can't say hand that out. File of Life is still around Dane County to my knowledge. I know there's a lot of different things. So we use mainly those safety plans. And if it's for an older adult or someone with dementia, get all that information on those safety plans. We do know to look for, File of Life if we're on a call. The problem is people leave them in all different areas, in my experience. So, but we are familiar with definitely what that is in that program. So, oh, the one thing I wanted to mention too, even with everybody, but even with older adults, when I talked about some of the cases being taking a little longer and a little more complicated. Again, sometimes it's not just dementia, it's dementia with substance use, or dementia with a co-occurring mental health diagnosis, or, you know, some sort of a combination, or there's hoarding involved, or some sort of an issue. So sometimes these get a little more complicated, and we're bringing in other community partners to help us with these calls. So as we get into the next slide, which is just a little bit of data that we have, be mindful that it's not really capturing everything and all the time commitment, but we're doing what we can. So the next slide, Mike, is just a quick overview of some of our data. These are mental health related activities. Most of them are active calls for service. We do document anything mental health related that we're doing as far as presentations or training. Again, that's like 25 instances in the year. So we first started collecting the data in 2019 because that's when we had our first embedded crisis workers with us on the department. So you can see as we got into COVID and out of COVID in those years there, how our numbers increased dramatically, really. It's quite a bit. This year, we are not as high as last year right now. We'll probably be pushing maybe more like 1,600. So again, some of the cases we've had this year though have just taken a significant amount of time and been more complicated, but they're only assigned usually like one instance, right? So it's not accounting for all the follow-up maybe that's done under one call and whatnot, but I still think in general, and I've talked to Dane County Crisis recently, just organically, they're able to say like their calls into their unit has also increased. The emergency detentions, to my knowledge, have increased a bit too. So there's still a high need out there, and a need for this work to be done. I'm grateful that I'm allowed to do it within our department, within a police department, because a lot of the calls, first calls for service, are still coming into 911. And it's going to uniform patrol officers. That's just the way of it right now. We don't have all the diversion programs set up, or a CARES team or things like that to divert people. So it's still law enforcement as the primary responder. So yeah, so that's what I have. The next slide will be my contact information. So take a picture of that or write it down. Well, I did not put my email on there. I can give you guys my email. Let me see if I can get that in the chat, and then we can take some questions. So if you just have like programming questions or things like that, feel free to call or email me anytime. If it's something more specific to something active going on, please call dispatch or 911. Don't call my office line. I am going on vacation in like 3 days, so I won't be back till the next year. But anything, questions, mental health related, presentations, training, program stuff, we're still learning every day. This is a new program for us, but I'm happy to answer those questions at any time. So
Leslie, is there a general contact, say that you're out on vacation, and they, people are interested in now, not next week, who would they get in touch? Just call the sheriff's office?
it's called non-emergency dispatch.
Uh-huh.
We don't have any, there's just not enough of us. So we don't have a specific line that's checked or generic email or anything. So if you need something more immediate, call non-emergency dispatch, and they can see if one of our crisis workers is working, or one of my deputy partners is working to answer any of those questions, or if you need immediate assistance.
Good. Feel free to jump right in and ask Leslie your questions. I'm not gonna.
Amy has one, wondering if 911 workers in dispatch also receive mental health training similar to law enforcement. I do not know actually what their current training looks like. That's a very good question though. That's a really good question. So I can't accurately answer that one though. We have at least 5 more minutes if anybody has any other questions. If there's something you need me to clarify, if I spoke too fast and you need me to go through anything else, I'm happy to do that now.
Leslie, this is Amy.
Amy.
I just want to thank you for all the information, because sometimes when I'm working with families or clients, just knowing what the response might look like if they were to call or they needed to reach out, and just having some of that information in the back of their heads is so helpful. And so I feel like your presentation was all that. Like, this is what you can expect if you call and you have some mental health needs or some dually diagnosed needs. This is what you could expect from the deputies. So I really appreciate it.
Yeah, and if there's ever anybody, Amy, that's in my area that wants things explained a little more thoroughly outside of a crisis situation, then that's something that we're happy to do.
Oh yeah, I have your number, Leslie.
I know.
You're on speed dial.
Yeah, and I'm out in field services, like out in this community for, I mean, a lot of years. I feel like my rural community out here, because I've always worked in a rural area, they're really used to law enforcement responding. They're actually, I think, more shocked if we bring a civilian crisis worker with us, which I'm super grateful for, because I think it gives them a better response. But in general, I think everybody out here is used to, since we don't have some of the other fancy programs or anything, are pretty used to having a uniformed officer response, and is pretty used to that, whether good or bad. So we get a lot of positive feedback on that, because I think that's what we're used to in the rural area.
I have a quick question. That's okay. This is Kate with RSVP.
Hey.
Hi, Leslie. Thank you so much for this, by the way. I guess I'm wondering first, do people of all ages contact you, or is this typically mostly adults, or?
No, we have a lot of calls involving children. I actually have, when we're done here, follow up on a kid that's 8.
Okay.
We get I've seen calls even younger than that, with somebody's calling law enforcement for some sort of incident with a very young child. So
Okay. All
um,
right. You know,
all ages.
I'm thinking so much about the events that happened in Madison yesterday, and that's just so weighing heavy on me. And I guess I just want to know that not even know. I'd really like it to be out there, everything that you've taught us today of like contacting and how to contact you. So is there a way that you spread your information to the community of like, hey, if you have mental health challenges, if there's something that's scaring you, or if there's something wrong, here is how you contact us. Here's the protocol, the phone numbers, this is that. Like, how do we get that out there to people more? Or maybe it already is, and I just don't know.
That's a good point, and a good question. I mean, a lot of different ways. Our school resource officers
Okay.
know we're around. Most of our county youth are going to a school in a different jurisdiction, if you will. Like some of my kids down here, they go to Stoughton, right? Or they go to McFarland High School.
Yeah.
So if they have a school resource officer, that's always a good way for information sharing.
Okay.
Also, I do a lot with children and adults with special needs, whatever that looks like. And so we have a good relationship with the Community Ties program at the Weissman Center. And so all of their safety plans that they do, that they have permission to share, get sent out, not just to me, but to other like mental health teams. So they're very aware, and sometimes I get extra questions or requests based on that, just because they know who we are as well. Our sheriff's office website has information. Again, we've gotten out to several community events this year, whether it's coffee with a cop. We did a partners fair at the courthouse, so the judges, the assistant district attorneys, all of those folks got information not only on my program, but other programs around the county. Things like National Night Out, Safety Saturday. We've been able to get in on a lot of those events and reach out to the community in that way as well.
Okay.
So those are just some examples.
Yeah, exactly. I would love to see giant billboards that have your, the phone number to contact and the email address to reach out to. You know what I mean? Like,
Yeah.
you are loved. There is support for you. Here is the information, and just like Batman it into the sky. So,
That'd be you.
because you guys do such great work, I just want to make sure people know to use you, because we all need it. We all need, resources and support. And so thank you.
Thanks.
Hi, I'm Linda Kuska, and I guess I'd be called a consumer in terms of a family member. I write that a caregiver like myself could contact the police in the jurisdiction in which I live and submit a safety plan for my loved one so that they would be on their radar that this is a mental health situation.
Sure, and I can't speak to how every jurisdiction handles it. I do know if it's in our jurisdiction, then absolutely reach out to us. I know obviously City of Madison has a big mental health team. You could reach out to them. Outside of that, I would just reach out to your local jurisdiction, explain the situation, and ask what they have to offer. If that is something that they even do. I can't speak to what every single jurisdiction is doing, but I just know what some of the bigger ones in Dane County are doing, similar safety plan type situations like we are. But it doesn't hurt to reach out. People have reached out, and I've gone and met people completely outside of a crisis. Maybe they never had any law enforcement contact ever before, but better to be proactive about it if you have a concern for future contact with us. And we even had one where I did that, and the young man was able to be a part of what it looked like in his safety plan. And we did end up having a crisis situation with him after that. And everyone just felt like it went so much smoother. He had already seen what the uniform looks like. He'd had a positive interaction with me. I wasn't working during that crisis situation, but the deputies had positive interaction with him. He was actually even remembered my name and was asking for me, but he was very satisfied to have the other deputies that, wore the same uniform as me. And so it ended up being a very positive outcome. So that's sort of one example. And again, he had been able to be a part of his plan and knew that there was one and knew that he needed that help in the moment. So, yeah, Linda, I would say reach out to whatever jurisdiction that is and see what they have to offer. So I think it's a good idea. More knowledge for us is power. I mean, I've been on calls where it was not evident that someone had dementia or a special need or even like schizophrenia or something. And I'm like, gosh, that would have been great information to know right from the get-go. We could have approached it a little bit differently, or maybe someone that wasn't verbal. And so we thought they weren't responding to our commands, but really they communicated in a different way. So that's all really valuable information to have ahead of time. And so, yeah, I encourage you to reach out if you feel comfortable.
Thank you for your work.
Thank you.
Anyone else? So real quick here before Leslie has to get moving.
I had a question. This is Tom Howells. You said you've been doing this a long time. I'm interested in trends that you see in the types of cases you've gotten. Have they changed over the years? And if so, how? Thank you.
Yeah, I don't know if I'm just more informed, but I've been out of the jail. That sounds like a strange statement, but deputies all start out in the jail. So I've been out of the jail since 2001. And I don't know if I just didn't really know what mental health was back then, or we weren't identifying it, but I see more mental health type calls I see more dementia, more kids at a younger age that are having bigger behaviors. Seen a lot, especially this year, a lot of mixed use with drugs and various THC cannabis products that people are maybe using to self-medicate, but it's actually, and I think there's like, I'm not a doctor, but I think there's research on it that is really exasperating what they're meant, like they have a mental health baseline, right? But then you use THC or THC gummies or all these synthetic things, Delta 9, whatever. I'm not a big drug person. And it has like exploded their behavior, and they had a big behavior that ended up in hospitalization. We had, I don't know what was going through Dane County, but we had some pretty big back-to-back cases where that was the case, where I think people on their own were managing okay, but then you mix it with something else and it just like exasperated the situation. So I've seen a lot of that as well. So yeah, just more complicated cases, multi-factors, co-occurring issues. So mental health with a substance abuse, mental health with a special need, mental health with dementia. Sometimes it's all of those: mental health, dementia, AODA, you know, a lot of alcohol. It's Wisconsin. A lot of alcohol use and abuse. So sometimes it's like all the three big ones, and they can be pretty difficult cases to navigate. So I don't know if that answers that, Tom, for you, but it's a good question.
Anything else? If not, then I'd just like to thank you, Leslie, for all of your help with Triad, and especially with this presentation today. It's been incredibly informative, and I'm glad you're on the job. You don't look like you've been on the job for this many years. You know, you're still, you know, have a great attitude, and, you know, it's fantastic to know that you're out there working on our behalf.
Great.
Thank you, everyone.
Appreciate it.
Thank you.